DVT, as you all know, we are celebrating March as the DVT Awareness Month. And deep vein thrombosis, I think by now quite a few are aware, and we are so happy to see that many awareness programs are being done, and people are getting more and more aware of this deadly condition. Deep vein thrombosis is a clot in the veins, mainly in the deep veins. So it's commonly seen in the lower limbs and especially in the legs, calves, and thigh. That is where it is. And these clots form small blood clots form in the veins. These can progress, these can spread, these can accumulate and keep progressing up. And some of them tend to break off from the veins, inside the veins, and go into your lung veins, and that's when it can be fatal. And that is one of the most deadliest complications of deep vein thrombosis. Now, apart from the pulmonary embolism and death, which DVT can cause, it can also cause long-term sequelae in terms of, phlebitic limb, and years later it can cause breathing difficulties, lung capacity comes down, legs forms have pigmentation, you can have varicose veins, severe ulcerations, and heavy nagging pain. So these are something which is quite common. Now, one of the thing about DVT is it's not that it has to occur in any diseased condition or a diseased individual or a particular morbid situation. It can happen to anybody, any normal person walking around, can develop deep vein thrombosis. One of the factors which we should keep in mind is, prolonged immobilization, long travelings, especially flight travels, long haul flights, maybe more than 8 hours or 6 hours, where you're sitting in one position. So any position, any travel which involves long sitting is a condition which can provoke DVT. And this also gets aggravated by dehydration, like I said, immobilization, whether it is travel or any other condition, even if you're sick and bedridden, not active for a long time, can cause DVT. So it is something which is inherent, which can happen to anyone. Of course, there are conditions where some situations or some patients are more prone for DVT, especially patients or people who are on the heavier side, the obese side, patients who have history of smoking, patients who have history of dehydration, patients who have history of clotting in the family. So these are situations where DVT can be more commonly seen. Now, I mean, the thing about DVT, which is there in the society among any patients, it's like I said, it's not necessarily happens only in patients. It can happen to any individuals within the hospital, outside the hospital. The good thing about this is it is preventable. It can be prevented. It can be treated. Now we have wonderful drugs. Earlier we had to go on with injectable parenteral treatment to treat DVT. Long-term hospitalization was mandated. Nowadays we have great research molecules available, which you can take it as oral tablets, and it can be treated by simple medications. More importantly than treatment, I think we have to look at how we can prevent it, and the prevention is a mandate of any medical professional to see that we prevent the disease rather than treat the disease. So DVT is one of these situations where we can prevent. So for people who are traveling, who are bedridden, who have limited activities, definitely do try to keep your hydration well. Try to keep mobile as much as possible, even in flights, even you're traveling. Try to do your keep your legs active. Try to keep moving your feet. Try to move your ankle, your toes. That definitely helps your blood in circulation, and that does help in preventing DVT. Yes, patients who are in a higher risk for developing DVT, there are drugs available. There are other various modalities available to see that you can take these drugs as prophylaxis for patients who are prone for DVT. And of course, stockings is something which we commonly advise. Good compression stockings is very helpful in prolonged travel, prolonged patients who are on bedridden or even otherwise in conditions where you tend to be sitting in one position. So all in all, I think DVT is a disease which has been there. This is not something new. This is not something which has happened in the present AI generation, which is there now. It has always been there. The good thing is lots of work has gone through this, and many research molecules have come out. Oral anticoagulants is one of them, which has done wonders in trying to prevent and treat DVT. So this is something we need to be aware of. And just to put you a global perspective, it almost stands number 4 among the mortalities. If we look at the all-cause mortality globally, DVT stands on the 4th list of causing mortality. So it's a very common prevalent disease, and it is widespread among all across the globe. We in India or Asians are not exception to this disease. We are definitely more prone. And with our present lifestyle, I think it is definitely imperative that we all understand what DVT is and see how we can prevent it. Thank you.